18 years ago, I was asked to start the work of being coordinator of care for the sisters. One of the reasons I was asked to take on this job was that the doctors were telling leadership, you're having sisters coming to clinics and being discharged, and we don't know if it's going to be followed up on, and we need somebody. And so the summer before I was asked to do this, a task team was asked to be formed, and they were the ones that felt too that this should be worked at. So then I started.
So it's kind of like people depend on their children or family members to check in with them. They can't just be independent and going to the doctors and coming back.
Right.
So yeah.
Right. Because as soon as I got started at the hospital, and we would have sometimes as many as 4 and 5 sisters there at a time. And initially, some of the people knew me, but I always stepped back and never asked. I never tried to threaten the nurses. I was one myself, and I know what it would feel like to be threatened in the job from this person who they've met probably 2-3 times. And later on, I don't think I was in this work more than about 3 months. And because we had sisters almost every floor except OB/GYN, of course, everybody got to know me. And they got so that they would take the chart and look over the major things. They'd say, you can come and look. And once in a while, a new nurse would be on, and I would ask a question, and she would go, and who are you? And some of the older nurses, the longer-term nurses, would go, she's legit. Just show it to her. And I said, if you understand, I'm like your husband. If you were hospitalized, I'm the family member like your husband. And I ask those questions because regardless of where the sister is, I report back to either St. Scholastica's, St. Ben's, or whoever. And therefore I need to know because we need to follow up. And now I know everybody, I think, in the hospital practically. And I love my work, and it's been one of the most difficult tasks, especially at times, but it's also one of the most graced works that I've ever been asked to do. Not having a 9-to-5, and I've gotten so that these last 18 years, I know that, and you adapt. And the things that have made my life easier is cell phones. I always use the same car for my work, so I don't have to do the things we do otherwise. Knowing everybody at the hospital helps a great deal. And like at the center, I know some of the people at Good Shepherd's Country Manor. Knowing the facilities help. The support of leadership and the sisters helps a great deal. And then I guess my love of it. And when I'm called away at a different time, you know, once in a while at night, I think after this long a time I'm able to set aside my lack of sleep and know this person needs me now. Mm-hmm. And I've always tried to do that. When they ask to see me, I try to respond, because I know sometimes how hard it is for some people to ask for help.
Yeah. I
would find it hard. The other part that I love is, as one of our nurses told me a few years ago, Sister, you are like an ombudsman person, a social worker, a nurse, the whole bag. I mean, it just, you just get to see so many different people, and there is never a time that I don't learn something new. And that has been a real, at times a challenge, but I feel after all those years of experience, I'm up to it.
Mm-hmm.
I know my strengths and I know my weaknesses, and I just want to stay in it as long as I can.